Chapter 13, Video 3. In this video, we're going to talk about ventricular hypertrophy. Hypertrophy is the excessive growth of tissue. So with ventricular hypertrophy, we see the excessive growth of the ventricular tissue, okay? This can usually be a result of disease, and this thickened tissue requires more current to depolarize, okay? So it causes greater than normal amplitudes of QRS complexes in the EKG in the affected ventricle. So the normal QRS with ventricular hypertrophy would appear to be taller or deeper than the regular 13 millimeter in any lead, okay? And so you're going to see a change in the height of this. And so this is a slide of normal QRS amplitude voltage. And then looking on down, you can see a bit of a difference here. With ventricular hypertrophy, if you have right RVH, right ventricular hypertrophy, you're going to have a tall R wave in lead V1, and you're going to have a greater S wave. So you'll see that right axis deviation with the T wave inversion. And the causes can be chronic lung disease, which causes that right ventricle to buck up because it's pushing blood into a high pressure area, which is the lungs. So this is what you see with that RVH, that right ventricular hypertrophy. So looking at this slide, you can go on down and look at this. And then with left ventricular hypertrophy, LVH, you're going to see that R wave in V5 or V6, which is taller, and that S wave in V1 or V2, which is going to be greater than or equal to 35 millimeters. Again, hypertension, it's pushing against a high resistance in the body. So that's why you see that ventricular hypertrophy. So taking a peek here, this is what you would see in that situation. All right. Scrolling on down with, let me get myself in the, all right, with ventricular hypertrophy, we can do a low voltage EKG. Some people have an abnormally short wave complexes. Any condition that can muffle the cardiac impulse between the electrodes on the skin. So there's with the ventricular hypertrophy, if you see obesity or if a patient has emphysema or myxedemia or pericardial effusion, that would be what we're talking about there. These conditions could muffle what we see on that EKG. So going over, this would be what we see with a lower voltage EKG. There are several different clinical implications with ventricular hypertrophy. It increases the oxygen demand because we have that enlarged ventricle, and it increases the likelihood of ischemia or infarction with this. We have ventricular dilation, which stretches the myocardial fibers, which results in the overfilling of the ventricles and inadequate pumping. So it doesn't pump out like it should, and it stretches out and let those ventricles get too full. And we can see a pattern on the EKG with this. I want you guys to go through and do these practice strips 1, 2, 3, 4, and 5. Take care of looking at these practice strips and make sure that if you have any questions to reach out to me. The answers to these practice strips, again, are in the back of the book. But the big thing that we need to look at is that QRS complex when we're speaking of ventricular hypertrophy, because that tissue is enlarged and it's abnormal. And one thing with these guys, they're at risk, okay? They're at greater risk for having a myocardial infarction related to a rhythm issue. It could cause, it can mess with that conduction system as well. If you have any questions, please let me know.